Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader as a follower. And the leader as a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty. Episode 51 of HLA Live is hosted by Eleanor Morris from the Women in Healthcare Leadership team. It is entitled Gender Equity in Medical Education.
Hello everyone, my name is Ellie Morris. I'm a final year student with Hull York Medical School and a scholar with the Healthcare Leadership Academy. And today I'm delivering this webinar on behalf of the Women in Healthcare Leadership Initiative, which has partnered with HLA Live for a series of webinars. Hopefully you've seen some of our previous webinars focusing on different themes focused on women in healthcare leadership, but now we're going to look at different sectors and professions related to gender equity, starting tonight with gender equity in medical education. So on that thread, we're going to be speaking to a series of students and people involved within medical education to gain their thoughts and ideas related to this topic. For myself, throughout medical school, I've seen examples of where sexism has been present and where it has and has not necessarily been dealt with in the best way. And it'll be interesting for us to hear about how medical schools may be able to better prepare students and tutors for handling such situations. So without further ado, could everyone please introduce themselves?
Yes, so my name's Ollie. I'm in my 4th year at Hull York Medical School.
I'm Abigail. I'm 24 and I'm a second year graduate entry medical student at the University of Warwick.
I'm Pedra Rabi. I'm the HLA Live lead.
So my name's Bryant Lee. I am currently a final year medical student at the Hull York Medical School.
My name's Jane Dacre. I'm Professor of Medical Education at UCL.
As well as that, I'm a final year medical student, soon to be a foundation doctor in August.
I'm the first in my family to go to university.
I'm lucky enough to be the Student Staff Committee Chair.
I'm also a GMC Student Associate and I've had 6 years with a charity organisation called Students for Kids International Projects, or SKIP for short.
I sit on a number of different boards here at HIMSS. So I sit on the Board of Studies, the Joint Senate Committee, because Hull York is between 2 different campuses. There's a lot that goes on there. I sit on the Equality, Diversity and Inclusion, as well as the Athena Swan Committee.
I always kind of knew I wanted to get involved in healthcare, but didn't know I wanted to be a doctor until much later, and hence the graduate entry.
Okay, so we'll move on to our first question, which is actually extremely broad, and it's just surrounding what your experiences are of gender equity or inequity within medical education.
Okay, so I think the big one, and as I've gone into placement, is the one that I think I'm faced with almost every day to an extent, is that moment when you introduce yourself, whether it's to doctors when you're heading in or to patients, my name's Abigail and I'm a medical student, and it's always, what are you training to be? A nurse. Mm-hmm. Yeah, and I'd always heard stories about it and I thought, that can't happen, that's not, you know, not something that happens very often. I'm sure every now and again it happens. And then it started to happen more and more, and it became a constant thing. And I was like, you stop being able to respond to it.
I have on occasion been present when there have been uncomfortable moments between, you know, either patients or teaching staff or other professionals, you know, where you know, I say I'm a medical student and that's recognised as, oh, so you want to be a doctor, and then one of my colleagues will say exactly the same thing and go, oh, do you want to do nursing?
It's not just about patient contact. It is from colleagues, it is from peers, and it's from supervisors as well.
So currently I'm the co-advocacy lead for the Gender Equity in Global Surgery Initiative, which is an organization that aims to address gender disparities in surgery, obstetrics, and anesthetics across the world. And I do this through research, advocacy, and mentorship. In terms of medical school, I don't have a personal role in the gender equity role, but I have faced different issues in terms of being a female who really wants to pursue a career in obstetrics/surgery. I haven't still defined which career path I want to take.
There's that whole stereotype with regards to surgery. I know several of my female colleagues really do and are interested in surgery. And I think that the stories that I've heard of, you know, very inappropriate comments about how women should go into surgery, how, oh, they'd faint on their feet and things like that. It's a stereotype, but it's a stereotype for a reason. And it's because at its core, that culture still exists.
I didn't for a long time think that people would try and change my decision because I am a woman, and not because they think that speciality is a fit for me or something that I will enjoy.
I've still faced a lot of these issues as a medical student.
It's why don't you do GP, or why don't you pick obs and gynae because you're a woman and that's a good thing for you, or you can balance your other life commitments around that. And yeah, I used to just brush it off and be like, oh, I haven't tried those yet, I'll have to wait and see. And now I'm just like, I'll pick what I want to pick, thank you.
I suppose personal experience, I don't have a whole lot. I'm very fortunate in that a lot of the time teaching sessions do feel like they're run equitably between, you know, students of all genders.
As a male, personally, and somebody who identifies as male, it's really interesting to think about, because actually I haven't personally experienced any sort of sexism, but I think that it's really easy actually to gloss over when my female counterparts are actually going through issues. I think that for me personally, there have been times when, for example, you know, there's been a supervisor or even a GP when we're on placement, and they have said something that isn't necessarily very appropriate, but I didn't think anything of it until it was actually pointed out to me by my female colleagues that they felt uncomfortable with that.
The other thing I really struggled with was the stigma of how we were expected to dress as women in hospital. This was before, you know, so scrubs are now mandatory for us, but before all of that we had to wear our own clothes, and I always found it really difficult, like, and you know, and my clinical partner is male, and I would always be like 5 minutes later than I said I'd be to pick, like, you know, to meet, and he'd be like, oh, you're late, and I was like, yeah, sorry, I was getting ready, or I was like, oh, I had to change my outfit at the last minute. He's like, oh, I just put trousers and a shirt on. And I always think that there's such a stigma with women in healthcare about how we look. We have to be able to, we have to look nice, but we also have to be able to go and, you know, get messy, or, you know, get on the floor and do all the things that guys can do by just lobbing, you know, chinos and a shirt on. And that that way that people look at you when you walk into somewhere for the first time, and they're not looking at you as a medical student, they're looking at what you're wearing and making that decision based on you. If you dress too nice, then you're not taking it seriously, but you don't dress smart enough, you're not taking it seriously.
They have to just take it on the chin and accept that that is something that happens. And that in itself is unacceptable. I don't think that anybody should ever feel that way.
I concur with a lot of the answers that have been said so far. I certainly think being a female, you do get more comments related to being a nurse, for example, as has already been mentioned. Moving on to our next question. From what you've experienced or from what you've observed, what do you think are some of the problems and barriers faced specifically by female colleagues as opposed to males?
Well, it comes in different sectors. For example, if you look at research, if you look into where people are, what backgrounds people have originally before coming into medical school, or if you look at what careers they want, what specialities they want to pursue, there's a lot of issues going in from as a female medical student.
I think the biggest one is complacency. We're in a society that battles for change all the time, but once, I think we do it in a lot of things, that we make the change and we get more women into medicine. You look at the gap of registered doctors, and it's so close now. We're almost identical, and in some cases there are medical schools that have more girls than but once we get them in, people think the job's done.
It starts with our training, and I think that it is more of a top-down issue as well.
There's to do with perceptions, whether you're how the public might perceive, what a doctor looks like, what a medical student looks like, what that means. I'm not sure necessarily it's always really clear what that means, and it's really nice when, say, the tutor that you're with goes, "Oh, these are my students I'm taking around today, they'll one day be doctors."
Say, for example, you have, let's paint a picture of quite a small person, okay? In this case, they are female, okay? And they're performing a task. So let's say that they're being tasked with performing CPR for a procedural skill that they're training in, okay? And the trainer in charge might say something along the lines of, "Oh, if it's okay with you, you don't have to do as many rounds as your colleagues," for example. And I think that in itself is really it really excludes people, and it singles them out as being different, and that's an issue in itself. That stigma of, "Oh, you might not be able to do as much," I think that really speaks volumes, when actually a lot of people would argue that that's a very caring thing to do.
And I won't say anything because they're in charge of me, and they're the people that are going to sign my, books at the end of placement and things like that. So I won't say anything about how actually you should talk to me just as much as you're talking to my clinical partner. And I also think that we're complacent in letting patients make assumptions like that.
In terms of research, as a female, what we usually see is that we have to reach out for these opportunities, but most of the time we're waiting for these opportunities to come towards us. And it creates a massive barrier, because what's happening on the other side is, for the male medical students, they reach out to many different researchers and ask if there's opportunities out there. And it makes me question why we have this mindset that we're afraid to reach out to different academics to pursue research opportunities. We're looking for that social media post being like, "Here's an opportunity for research, sign up here and apply for our application system," when really we can boycott that and ask different researchers that we haven't even met before if there's an opportunity to work with them on a specific topic. And for some reason we just don't do this. We shy away from this opportunity, but instead we look for a more formal opportunity, which creates a massive barrier in our mindsets going forward.
But I also think a massive barrier is lack of role models. I read a really interesting statistic recently that there are 24% of all medical directors within trusts within the UK are women. That's not even a quarter. And that 32% of consultants are female in the entire of the UK. And that seems nuts to me.
What tends to happen is a lot of the male surgeons tend to help the male medical students, because the male medical students say that, oh, how can I become a surgeon? Can you provide me some assistance? What do I need to do for my portfolio, etc.? And they talk to the registrars, they talk to the consultants, etc. But as a female medical student, what I've seen and what I've done, which made me question certain times, is I've created this shyness approach, saying that I'm not actually sure if I want to become a surgeon, or I'm considering it, or I've thought about it, but I'm still not sure, and I still don't know how to get there. And then the consultant looks at you and says that you're not confident enough, so probably come back to me when you're more confident and this is a career that you want to pursue.
Women are then perceived negatively for wanting that. So it becomes this vicious circle. So I have a really there's that moment that sticks with you. And I remember asking my clinical partner some questions, we'd taken patient histories and he'd come up with a diagnosis and a management plan. And I was asking questions about, why? Why are you thinking about doing that? Why are you thinking about this? What made you think that? And he turned around and he went, you're being a bit overbearing. And he's a very good friend, and he still is my very good friend. But I took that ow, that hurt. And I went away and I stewed on it for a few days. And I thought, you wouldn't have said that to me if I was a man. If I was a man, I would just be asking questions. But I'm a woman, asking questions and questioning your judgment. But I was questioning his judgment because I wanted to understand how he was thinking, And I think that becomes a big barrier. Now, I don't think I will ask questions. I don't think I ask questions the same way anymore.
When I was a first year medical student at King's College, I remember going around the room and a lot of the male medical students were like, I want to be this, I want to be that. And they still weren't sure they wanted to do it, but they were so confident, saying that I want to be a cardiologist, I want to be a vascular surgeon, I want to be a rheumatologist. And they were so confident. Whereas for the female medical students, they went around being like, we're not sure what we want to be. We want to explore. Maybe I want to go for general surgery. Maybe I want to go for cardiology. I'm not absolutely sure. And it was interesting how we go in and we have these mindsets that we're not confident enough to advocate for what we want to do, or even though we don't know what we want to do, we don't say it as confidently. And going forward, this mindset needs to be changed. And I don't think it happens at the beginning of medical school. I think it happens whilst we're in secondary school, primary school, etc.
So next, we're thinking more about what we can do about this. So how do you think we can better support those who have experienced sexism or have been discriminated against?
I think the first thing is to recognise that it exists. And then the second thing is to educate people about it.
Certainly, there are currently systems in place at several universities that provide for this sort of thing.
Quite often, when young women come into medical school, they think that they're on a level playing field. And actually, they're not. So I think they need to realise that they're not. So I recently led the review of the gender pay gap in medicine, and there is a big gender pay gap in medicine. And when young women go into medical school, they think that they're going to be paid the same as the men, or paid equally. Now, although equal pay is enshrined in law, there's absolutely no doubt that women's career and pay trajectory is slower. So in order to change that, people need to know about it. So I think things like that need to be available. That knowledge needs to be available to young women going into medical school so that they can help push forward the necessary changes.
And actually, I'm going to take an example of that. It's actually going to be to do with race. So actually, the BMJ published an article last year talking about how there were certain medical schools that actually didn't get many reports of racism, and they weren't ever formally reported, and as such they were never dealt with. Now, as somebody who is obviously Chinese, I have certainly experienced my fair share of racism, and I am almost 100% certain that those medical schools would not have had that sort of statistic where they simply didn't have any racism whatsoever, or any reports of racism that needed to be dealt with. And actually, that system was merely reporting and flagging up those cases. It didn't necessarily bring forth any sort of ramification, repercussion, or development on that side of things. And I think that that is ultimately what needs to change. You first need to have that feedback system in place, and for it to actually be able to empower students, empower staff to bring about changes for the better.
I'd hope at least that, you know, during the selection process into med school, you are selecting for people who are, you know, conscientious and looking out for other people. But of course, that's not, you know, a necessity for becoming a doctor. It's, you know, it's ideal, but it's not always essential. And I think sort of fostering that idea of looking out for not only, you know, the patient, but also your colleagues is a really important step that I think we're getting there within the NHS, but, you know, there's still some work to be done.
It's important that we all start to say something, even if it is those little things, because you have to change it from the bottom up. You know, if you've got a pyramid of issues and you start in the middle, the whole thing will crumble down. But if you start with a great foundation, then you can get up to the top and make all those changes. And I think it's really important that women in general in medicine and healthcare start to be like, actually, that's not okay, or be like, just, you know, be aware that saying something like that, you know, you're saying that to me because I'm a woman, and it's very obvious you're saying that to me because I'm a woman.
Me as a male ally, I would want to talk to that individual should I have identified it.
It's certainly important to say, if you're already have established that dialogue, say you've already been taking the history and you introduce your colleague, or so for me it would be another medical student, refer to them, say, you know, that this is one of my colleagues, she's doing the same thing as me, but she'd be all right asking questions as well, and sort of making sure that you make it clear that it's a equal footing that you're both on, you know, you're at the same things like that. I think also equipping students with the right tools to be able to confront that quickly would be really useful. If you gave students, it feels wrong to say set phrases, but sort of things that they can go back and rely on to say, in this scenario, if a patient says this is the best way to tackle that. It's not confrontational, but it, you know, it helps.
So something that I really admired, I know it wasn't as effective, but something I've really admired was the Women in Surgery directory, part of the Royal College of Surgery. They had this directory of all the different female registrars and consultants across the UK with their specialities of interest and how they're willing to help you, for example, mentorship, long-term career, family planning, etc. And they put this on a directory and you can reach out and email them. And I quite admired that because it created this, it created a bridge saying that if you're unsure about where to go, if you're unsure about your direction, or you just need some advice, etc., reach out to one of these women on this directory.
We need more role models in medicine for women, but not just in general. We need them in specific areas.
You just want a name to reach out to, and maybe they can, if they are not the right person for you, they can reach out to someone else.
We need, to see more women in orthopedics, to see more, gender neutral targeting of roles. Like, I read recently about that there was issues with people specialising in paediatrics because of the obviously the nature of that for people as they get older and start to have families. It becomes quite a mentally strained job. So the decision had been made that they were going to offer less than full-time training, because that meant that more women would sign up, because that meant they could still look after their children. And I remember reading that and going, less than full-time training, great, because that gives people flexibility, but not because they have to look after their children. Like, if we're going to, try and offer things out to people, you need to offer things out in a gender neutral way.
So we now have evidence from the research that we've done around the gender pay gap that women not only have flatter trajectories in relation to the amount of pay they get, they also have flatter trajectories for promotion, both academic promotion and promotion in the NHS. And so we really need to look carefully at things that we can do to change that. It won't be one single thing. There will be a lot of different little things that a lot of people will have to get involved with to change. But I think moving forward, we need to balance things up.
I went to a surgical event. There was a consultant who you could say was quite sexist in his comments about, he said something on the line saying that as a woman, you may not want to pursue a career in surgery because you want to be there for your family. And unfortunately, a surgical career does not support you to have a family. What we're seeing right now is that is not true. There are so many great surgeons in the UK, across the world, who have a family and are pursuing a surgical career as a consultant, and they're being through a training pathway that was not supportive. So that is not true. And right now the pathway is even more supported than ever. So what I did in that situation was I went to the Women in Surgery directory. I went to the head of it and told her about the situation and provided a name. And she said that this should not happen in a university setting from a medical society lecture. So she said that she would tackle it, and she will approach the person and tell them what they did wrong, and also educate them on the system. So going forward, what I should have done actually is that if I wanted to use the university's contact, etc., I should put this up to someone who was like the head of my year, the MSA. So that's the Medical Student Association, or even the dean of our medical school.
It's about promoting a culture in which they feel comfortable to be able to bring that sort of thing up. I think that, we do have this very negative, discriminatory, so oftentimes quite cruel attitude towards when people bring up personal issues or, issues within the workplace that have actually really affected them.
And it's hindering other people, because I wasn't the only female person who went to this lecture.
I've personally found in the past, and from talks with other people, that you'll find that most women, when they experience stuff like this, and I've done it, I go directly to my peers. I go to other women at the same level, or maybe a year or two above me, because they've gotten through it, and ask them how they've dealt with it, or collect almost like a support network of what did you say? Okay, so I know what to say next time.
For me, I think that it kind of gets laughed off sometimes as a male, because you have these elderly women on occasion, and I am stereotyping here because it's not just elderly women, that make inappropriate comments like, ooh, I've got a nice male doctor today. And I think that we don't really talk about that very much, and how awkward that actually is, and how inappropriate those comments can be for male counterparts within the profession.
Only I'd have gone and told that person. Only I'd have sent that email that I wanted to write to say, I don't think it was appropriate, and I felt that, I don't want to take this formally anywhere, but I do think that there should be some education given. But I don't think we do it because we're students and we are at the bottom of the totem pole. And these people that we want to go and complain about, these are the people that sign our grades.
I'm absolutely delighted at the number of women going into medical school, because women make fantastic doctors as well as men, but it didn't used to be thought that they did. But I think that we all have a responsibility to level things up for those who are coming up lower down the ranks.
Thank you very much to everyone who's joined us across this episode. It's been really exciting to gain some different perspectives, and I really hope that this starts to generate more of a conversation about gender equity within medical education. If you've enjoyed this episode, please come and carry on the discussions on Twitter, and we will often have discussions on Clubhouse as well. So please do check out the Healthcare Leadership Academy and see what's going on there.
Thank you to everyone that made tonight's episode possible. Whenever our scholars are thinking about complex problems facing our health systems, we encourage them to think about how they make significant change in the world of healthcare. We are incredibly lucky to have some incredible scholars in the HLA. They use the HLA as a platform to take their ideas and bring them to fruition. If you are interested in the work of the HLA, why not join us at one of our future HLA events? Why not join one of our programs? Why not even become a HLA scholar? Thank you for joining us. My name is Johan Marlewiner, the director of the HLA, and it's a good night from all of us.